Ready? Hi, I'm Dr. Brian Gillis, and I want to wish everybody happy holidays. The message that I want to send today is I just want to kind of give you a tour of the uniqueness of our office that we have here at 8 Water Street, Oakland, Maine. As you look around the office, a lot of the things in this office were provided to us by patients after seeing us here. Our office is a very friendly atmosphere, adorned with things. This particular picture here was painted by an autistic girl as she waited on me for her appointment of some of our boots in our office. This over here was donated to me by a patient a long time ago who was a famous artist in Maine. He thought it would look nice in our office. This is a horseshoe that somebody had found from a logging horse, and this was circa 1924 of the farm that it was found on. And this here is a local artist whose name is, when you come to my office you can see, but he's done a magnificent job and he's one of my favorite artists. And one thing that you won't notice in our office is there's nothing that says payment due at time of services or anything that has to do with a financial patient obligation whatsoever. And we're able to do that because I'm in private practice. I'm not part of a big organizational program that's main focus is on the aspects of the financial burden that patients may have. So we don't have any of that here. And then as you come in through the door, you'll see that the rest of our office is pretty much the same way. One thing that you don't see when you look into the exam rooms is you do not see any type of computer equipment, which is also unique to our office. When you look in here, this is another exam room, no computer equipment. As you follow me down the hall, as you follow me all the way down here into the very back room, we have a computer. And that's our computer station. That's where the electronic medical record is. That's where we do our Medicare reporting. That's where we do our physician management prescription program, all the government red tape that we have, and the importance of the computer in our office. We put it as far away from the patient as we can. So follow me down here into my office. Now this, of course, is my office, and it's adorned with things that are important to me about Oklahoma, my family, other things patients that have unique talents have given me. This was given to me by a patient whose father was a surgeon in Cape Cod, and it was part of his collection, and he painted to reduce stress, and it fit in my office perfectly. This was given to me by a patient that I did a visit at his home in a trailer house in the middle of nowhere, Maine. And he painted this himself, which is unique. This was another patient who carved this out of wood, which I think is absolutely fascinating. So, where does that bring us? Why is that important? Because I recently saw a patient who had an experience that was unlike any experience that he'd ever had before. He went for his annual physical, and the person greeted him. It was a practitioner that he had never met before. And he sat in front of a computer and he asked him a litany of questions. What kind of medications do you take? What's your family history? Do you smoke? And then he answered a whole bunch of stuff. And then after about 5 minutes of him just focusing on the computer, he said, "Your visit's over." And the guy said, "Aren't you going to check my prostate?" And he said, "No, I normally don't do that unless you really feel a need for me to do that." And he got up, and as he was checking out, he thought to himself, what has happened to medicine? The guy never even touched me and asked me questions on a computer, and he never really even looked at me. And he said, "Brian, what's going on?" So I thought about that for a little bit, and I thought, what's going on? When I have a patient come in my office, my focus is on them. And let me tell you a couple things about disengaging from a computer. When I don't put my attention on the computer, when I put my attention on the patient, the first thing I look at is their eyes. What do their eyes tell me? Are their eyes sunken and dark? Are they not getting enough rest? Could they have sleep apnea? Are the whites of their eyes icteric or sclerotic, meaning that they could have jaundice? Do they have sores in their mouth? Do they have lumps in their neck? When I look for them rashes on their body, the clothes that they wear, are they disheveled or are they neat? So much information is gleaned from the physical exam, and that exam is really distracted if you're in front of a computer. A computer has no objective ability to examine a patient and help with their treatment. The other thing a computer does is it puts a distance between the patient and the physician, because when the patient comes in, I can engage their mannerisms to see what is of interest to them, which may be important to their health, because stress and reduction of stress and anxiety go a long ways in preventing wellness. So luckily for us in our environment, we're able to provide all the things that the big institutions do, but we provide them without the computer as being the primary role of the centerpiece of their care. So how do I do that? Well, it's pretty simple. The government will pay me for quality measures. So if a patient comes in, I have these quality measures here, I'll ask him, do you have an advanced care plan? What is your weight? Is it normal, above normal? What should you do to make that better? Let's go over your current medications. Do you smoke? And then the last thing here is what's your blood pressure? And if it's high or low, what we need to do to correct that. And I take that information and I take it to the very back room at the end of my day and I report that information. And then there's all these other parameters that you have to do too, as far as a patient portal and e-scribing and blah, blah, blah. I do that not in front of the patient. I do that at a different time when the patient's already gone. And the reason being is because what the government thinks is important and what's important to this patient aren't necessarily connected in the right way. What really needs to happen is physicians need to re-engage with the patient, do the computer at a different time, and I think the patients will have a better overall experience of what they're understanding with their physicians and the relationship with their physicians and the relationship with their health. So anyway, with that said, we're still practicing old-fashioned medicine here at 8 Water Street, Oakland, Maine. And should you have any problems with irritable bowel or constipation, diarrhea, colorectal endoscopy, or any of the myriad of things that we like to treat, pending we have enough room, we would love to have your participation in your health care. And the other thing that we have too is that if you need me, you have my cell phone number and I'm available 24 hours a day, 7 days a week. So if you need a prior authorization, you call my office, we call the pharmacy. We're able to facilitate things that these bigger institutions put too many things in too many places and it seems very chaotic. In our office, it's pretty simple. The information stream is short, the people are well trained, and the care that we provide is optimum. Happy holidays.